As India, gets used to the fact that there is a second wave of the coronavirus that is raising its ugly head, it's also getting used to the fact that there is no shortage of Covidiots and corona villains who are flouting norms all across the country. Just take a look at this. More Covidiots are emerging from various parts of the country, whether it is nightclubs, whether it is election rallies, whether it is film promotions, whether it is festivals. There are flouting of norms taking place at a epic criminal level in different parts of the country, east, west, north and south. It would make you think about whether all of India's gains against the COVID pandemic will be lost as a result of just a few incidents of absolute COVID foolishness. COVID cases are on the rise, but so are these Covidiots. These are the 5 shocking stories we've picked just from today. There are many more, but these are the ones we wanted to highlight for you of how things are being violated so brazenly. Number 1, massive crowds at poll rallies as 5 states, including Puducherry, go to the polls. Irrespective of the party, whether it is BJP or AIADMK or DMK or Trinamool, thousands of people are being seen without masks or social distancing at rally after rally after Padyatra after Padyatra. The politicians, of course, don't give a damn. They just want these crowds to emerge. Take a look at these crowds that have been collecting everywhere. Number 2, popular film actor Puneet Rajkumar violated all COVID norms to promote his upcoming film. Just look at this. No care in the world, nobody wearing masks, big crowd. Promotion of film is priority. Number 3, all COVID norms similarly thrown to the wind at this Bengaluru nightclub. Just look at this. Nightclub, people dancing away, no masks, no distancing, enjoying their Saturday night, which is very much their right, but zero COVID protocol once again. Scary images. Number 4, in Bulandshahr, in Uttar Pradesh's Bulandshahr Mahotsav in UP, huge crowds gathering there, maintaining absolutely zero social distancing once again. Number 5, amidst all this corona foolishness and Covidiocy, shocking claim by a Gujarat MLA. Remember that fake news and false information is also dangerous. Gujarat MLA says hardworking people like BJP workers do not get COVID. That's a claim that a BJP sitting MLA has actually made. I want to go across now. I want to bring in an expert, Dr. Swapnil Parekh, who is author of the coronavirus. He's a very well-known Mumbai-based physician. He's been writing and tweeting very regularly about the dangers of COVID protocol not being followed, about people letting their guard down and how dangerous this can be with this latest surge. Swapnil, good evening and welcome. How scary and how dangerous is this? There are many things to complain about, Swapnil, but India has done some good things, and it looks like we've just picked out 5 incidents, and it looks like one of these could undo so much of the good work that has happened.
Hi, Shiv. There certainly is a bit of complacency creeping in the public, but we have to remember that this complacency came right from the top.
Yeah.
It came from the highest echelons of government in India. We had the best tools, the miraculous tools to out-vaccinate the virus. Unfortunately, for whatever reason, we started off too slow. People at the highest levels in government said that the lack of speed, the lack of urgency was deliberate. They wanted to iron out the kinks in the system. When your house is on fire, you need to put out the fire as quickly as you possibly can. I think we missed a bit of an opportunity, but it's not too late yet. Let me contextualize about Mumbai, because that's where I'm based. That's what I've been studying most closely. The reproductive number of a virus refers to how many people on average will be infected by one individual who is infected. So right now, in Mumbai, we are looking at a reproductive number of about 1.6. We expect, based on what data we have, we think that in Mumbai, around 60% of people have already been exposed and to the virus.
Yes.
With 60% population immunity, we would expect, in the absence of non-pharmaceutical interventions, for the R to be somewhere between 1 to 1.3. Right now, with non-pharmaceutical interventions, remember, educational institutes are still closed. There are some restrictions on movements. There are still some NPIs in place, and the R is 1.6. let's talk about Nagpur, for example. I think that's a particularly area of concern. Nagpur reports about 3,000 confirmed cases per day.
Yes.
We know that we detect only about 10% of cases. So I think an underestimate is that there are 30,000 new infections per day. This is in a city with a population of 3 million people.
Yes.
That's 1 in 100 people getting infected. Think about those numbers. Nagpur has a population immunity, in a Sero survey, were reported somewhere between 50 to 75% of people had already been exposed to the virus. This rate of increase is occurring in an area with high seroprevalence.
Yes.
That's the most alarming part. A lot of people are speculating that a lot of these infections are asymptomatic, that it's not as bad. Let me tell you, I've been talking to many of my colleagues in Mumbai, and they're seeing young people with a lot of pulmonary compromise.
Yeah.
Hospitalizations and fatalities are a late signal.
But
There's a
Swapnil,
time lag.
as far as complacency is concerned, sorry for interrupting, but I don't think people are going to get less complacent because we've only seen it increase more and more and more. So is out-vaccinating the virus going to be the only way forward? Because people know about protocols. These are not people who are ignorant about protocol. They know about the dangers of the virus. They know how it can spread. They are very well aware that these crowded situations can lead to a super spreader, eruption. So is battling the virus itself the only way? Because people are not going to suddenly wake up and be scared about what's going on.
No, Shiv, absolutely, you're right. Human behavior is very important, but as the virus, I don't think it's just human behavior. The point I'm coming to is that we are seeing the fastest ever increase in cases in multiple parts of the country, despite the fact that we have the highest level of population immunity now. There are more people who have had COVID and have recovered now than ever before. And despite that, right now, we are seeing the highest levels of growth.
Yes.
That indicates increased transmissibility. That's extremely concerning. And we have a huge blind spot in genomic sequencing. We don't know what's happening in the country.
Exactly.
So it's easy to say that people know what they're dealing with, but I think no one in the country knows what we're dealing with because we have such a blind spot in sequencing. When you look at the numbers that are occurring through the country, the really alarming part is the rate of rise in the context of the seroprevalence. And in pandemics, we need to move fast, we need to move early, and these are policy level decisions.
I hope
the biggest failure is not to move fast.
Yeah, finish your point.
If we wait for hospitalizations, if we wait for deaths, it'll be too late. We need to do everything. We need COVID appropriate behavior. We also need to out vaccinate this thing.
Okay, it's not one or the other. It has to be everything at once. Failure is not an option. It will take one eruption for this to get out of hand once again. And there is so much we don't understand. Thank you for putting that into perspective for me and our viewers. Dr. Swapnil Parekh, always a pleasure to have you here on 5 Live.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.